This is Kenya News Update today. In 2025, a silent epidemic claimed over 1,141 lives in Tanzania. Not from a virus, not from a natural disaster, but from a hidden wound that society refused to see. Coming up, you'll discover the invisible crisis tearing through families, the shocking truth about who's most affected, and why digital platforms became the unexpected frontline in a battle for mental survival. Meet Ronald Malisa, a 35-year-old businessman from Moshi and Dodoma. On July 10, 2025, his family found him in his bathroom. He had hanged himself, but here's the twist. This wasn't his first attempt. Multiple times before, he had tried to poison himself only to be saved by relatives. The source? Deep depression. And Ronald wasn't alone. On that exact same day, in the same Kilimanjaro region, another tragedy unfolded. Dr. Magrath Swai, a pediatric specialist, also took her own life. 2 lives, 1 day, 1 region. This is the face of Tanzania's mental health crisis in 2025. And then something shocking happened. The government made a chilling announcement. Suicide had become the leading cause of death among young people aged 15 to 29. Every single suicide represents countless more attempts among other youth. The numbers are staggering, but here's the part that will blow your mind. While this crisis was exploding, where were Tanzanians turning for help? Not to hospitals, not to clinics, they were logging on. Digital mental health service usage skyrocketed, especially among the youth and social media users who couldn't access traditional care. Instagram and TikTok became confessionals. Young people, workers in urban centers, and women bearing heavy economic burdens began sharing their experiences with depression and anxiety openly. For the first time, a national conversation was happening online. But here's what nobody's talking about. Beneath this digital outcry, a wall of silence remained. Stigma and discrimination forced countless others to hide their conditions, terrified of being labeled mentally ill or weak. The very platforms offering connection also became sources of pressure. Experts from Miami National Mental Health Hospital and the police force identified the brutal triggers: depression, family conflicts, unemployment, and abuse. Their research, covering January 2024 to June 2025, revealed those 1,141 suicides, with men making up the overwhelming majority. Dr. Paul Lawala, CEO of Miami Hospital, sounded the alarm on September 10, 2025. He called the number huge and increasing daily, demanding swift action from authorities. The implications are devastating. Some see a generation crying out for help in the only spaces available to them. Others see a societal failure of epic proportions. The controversy is clear. Can hashtags and posts truly combat a crisis this deep? But if traditional systems have failed and digital cries are the only sound being heard, what is the real solution for Tanzania? We began with a number: 1,141 lives lost. We end with a question: when a nation's youth are dying by their own hand, where does the responsibility truly lie? Do you think social media is helping or harming the mental health crisis? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news from across East Africa.